we will examine the effects drugs can have on the growth and development of the fetus. A fetus is connected to the mother's system by the placenta. With this connection, the fetus can receive nutrients, metabolic wastes, as well as toxins from the mother's system. If a mother uses a substance, the fetus can receive the effects of it through this connection. A fetus goes through many stages of development, and along each stage there are certain points of vulnerability which substances can affect, hinder, and retard the growth and development of certain aspects of development. Today we will look at alcohol, cocaine, nicotine, cannabis, and methamphetamine, and how they affect the growth and development of a fetus. Alcohol use during pregnancy. Fetal alcohol syndrome is a common result of a mother using alcohol while she is pregnant. It is a long-term condition. It's the most common cause of mental retardation. It creates an absence of left to right brain connections, which are very vital to a child's growth and development. There are about 19.5 babies born per 10,000 that have this condition. The most noticeable indicator of this condition would be the dysmorphic facial features, so you can see that on the next slide. Here you see microcephaly, a small head, and then the normal size head of a child, and hemangiomas are also a result of fetal alcohol syndrome, and these are benign tumors on a child. Here you see the small eye openings, smooth philtrum, thin upper lip, which are common facial features that are affected because of alcohol. 1 to 2 ounces of absolute alcohol carries about a 10% chance of fetal alcohol syndrome. However, even among chronic alcoholics, the incidence of this syndrome occurring ranges from 6 to 50%. So that's a pretty wide gap of probability of developing this syndrome. So just be aware that it's not a done deal. If you do have alcohol when you're pregnant, your child is not definitely for certain going to have this condition. There is a wide range of likelihood. So diagnosing this prenatally is difficult because the babies will appear normal when the physicians examine the mother before birth. The mothers are also not honest about alcohol use, and physicians don't always ask about the mother's intake of alcohol, which can contribute to this being difficult to diagnose. Alcohol is not present in the routine drug screen that mothers take, so there's no way for the physician to know about this before a birth unless he or she asks. However, there are new developments in biomarkers that can diagnose this prenatally, so these are very, very recent developments, so they're still developing to perfection, so just keep an eye on that if you're interested. Mental effects of FAS, easy distractibility, there can be behavioral problems, microcephaly, skewed social perceptions, as well as the average IQ of about 68 per child. Here, obviously, you can see that the brain's growth has been hindered, as well as the development because of fetal alcohol syndrome. Liver abnormalities, cardiac defects, organ dysfunction, less developed fine motor skills, as well as epilepsy developing are results that can occur because of fetal alcohol syndrome. Fetal alcohol effect can also be a result. This is where it's only about partial FAS, so you can have only the birth defects, or you could have only the neurodevelopmental disorder, or just bits and pieces of each. Here you see that it is not as severe, and the fetal alcohol effect is a little higher than the fetal alcohol syndrome. So fetal alcohol syndrome as well as fetal alcohol effect, children are socially less competent, and they're actually more aggressive in class typically. So we'll move on to marijuana use during pregnancy. Because there is such a variety of results from different studies that examine marijuana's effect on growth and development, we will examine the lowest range and the highest range for the sake of accuracy. And so the Center for the Future of Our Children did a study in which there were absolutely no factors, no consistent link between birth defects or pregnancy complications because of the mother's use of alcohol, or because of the mother's use of marijuana, excuse me. But the Johns Hopkins University School study, they found that there was a decreased gestational phase and the child's sleep patterns were permanently affected. But among white women, a low birth weight, a small size, and preterm delivery of the child was common, but non-white women didn't have these factors. So you can see there more factors are growing with each study we look at. University of Washington also examined the effect of marijuana on a fetus, and there was lower birth weight associations, delayed commencement of breathing, poor eyesight, tremors, there was a poor ability to adapt to the environment, the babies would spook easily, and also a hole in the heart was a condition which was likely to develop. Respiratory problems, these children had a greater likelihood of developing these, such as chest infections, asthma, chronic wheezing. Behavioral problems, when they reached about toddler age, these came up, as well as less developed motor skills, memory, verbal, and reasoning abilities. Also, 2 specific types of leukemia and brain tumors the likelihood of having these were increased in these children in this study. So interesting to note that they can range from absolutely no effect to increasing your risk of cancer. So just be aware and keep your eyes open for new developments and new studies that address this. Nicotine use during pregnancy. We'll see that nicotine use is associated with increased neonatal mortality, smaller head circumference, as well as low birth weight. There was a study which compared the placenta cells of 25 women who were exposed to secondhand smoke. And even with secondhand smoke, there were 158 genes were significantly deregulated in the fetuses. And these genes dealt with placental function, apoptosis, metabolism of lipids, stress response, blood clotting, as well as the extracellular matrix. Here you can see the estimated use of tobacco and nicotine, cigarette use among women while they are pregnant. Methamphetamine use during pregnancy. So there was a study by Linda Chang which compared 29 children between the ages of 3 and 4 whose mothers had been using meth while they were pregnant, and then she compared these 29 children to 37 children. And the MRIs she took showed that the children who were exposed had about 4% lower diffusion of molecules in the white matter of their brains, and this is why Chang proposes the group reached developmental milestones later than the control. So because of that result, there was also another study done by Elizabeth Sowell in which she compared a group of children whose mothers had used alcohol and meth, and then just alcohol during pregnancy, and the brain abnormalities in the offspring of mothers who used both meth and alcohol were significantly more severe than the children whose mothers solely used alcohol. So it's important to be aware of that. Cocaine use during pregnancy. You'll see that cocaine can affect preterm delivery, the born early, spontaneous abortion and death, and the average birth weight is lower, as well as limb reduction in the infant is quite common. Also, some studies show that about 15% of women prepping for delivery have cocaine use, which was shockingly high to me. So interesting to note that. Also, 8-year-olds whose mothers had used cocaine while they were in utero, their brain cells had alterations and deficits in them, and these brain cells were the ones that allocated certain energy, and they had a difficult time functioning properly because of this. So even after 8+ years of having been exposed to cocaine, these effects were still hindering these children's growth and development. Neonatal abstinence syndrome can occur because of the variety of addictive drugs we discussed. So you have your cocaine in there, as well as a lot of amphetamines, heroin, methadone. So these are basically symptoms that come to a child because the mother uses addictive drugs while she is pregnant. And basically these newborns exhibit symptoms that are basically withdrawal. So tremors, irritability. Interestingly enough, there is an inability to suck, which can hinder breastfeeding, and this leads to malnourishment oftentimes. The best way to address this is to create a peaceful environment with little stimuli so the infants can calm down. And then after about 7 months, if the situation is handled correctly, the child is fine, no negative effects. So clearly you can see from alcohol, marijuana, nicotine, and methamphetamines, and cocaine, they all have different effects on the fetuses as well as the child's growth and development. So it's important to be aware of what is happening. It's important to educate So thank you very much.